Hi, I'm Danielle.
And I'm Joe.
And we're Double Baggin It.
Two best friends.
Without buttholes. We're here today to tell you a little bit about our advocacy work.
Yes, we started doing advocacy pretty much almost from the beginning of Double Baggin It. We became very active in our local Crohn's and Colitis Foundation chapter, and we found opportunities to go to this event specifically that the Crohn's and Colitis Foundation puts on every year for IBD Day on the Hill.
It's Day on the Hill. It happens every May. The dates switch a little bit each year, but this was our third Day on the Hill and our fourth time in DC advocating. We did a little DDNC back in March, which was new for us, which was Digestive Disease National Coalition. So our fourth advocacy trip to Washington D.C. And personally, I find it very rewarding to be able to have the opportunity to go in front of our legislators as their constituents and share our stories on these issues that are extremely important to me, to us, to our IBD community. I find it extremely empowering and it's amazing. At first I was a little intimidated, but our fourth time around, we're kind of pros. And the great thing is they're just people like you and I. That's just their job, to listen to us and help use our voice to get it pushed forward.
Yeah, and one of the biggest things we can do as patients is share our stories, and that's what everybody out there who is fighting for us as well, all of the foundation, the providers, the industry folks like pharmaceutical companies, everybody who's there fighting for us as well. They really need our stories to help put a face to our legislators, show them the face of those of us who are living with these diseases. It helps really bring it home and personalize it for them to motivate them to do something.
Right, so if you are interested in how to get involved, you can look on Crohn's and Colitis, their websites, UOAA's website as well, and you can get involved locally. You don't have to be involved in one of your local chapters just as a constituent, as somebody who's fighting for these issues. You can call, email, and visit your local legislators, and if you have the opportunity, you certainly can go to Washington D.C. at any time and make an appointment to see them. They're there for you to visit.
Yeah, exactly. Find the thing that you're passionate about, the legislation or the policy or whatever you want to see changed. The big thing that we're passionate about right now is at the national level is passing the Safe Step Act, which here in Ohio we've passed a version of that last year. And it applies not only to those of us living with IBD and needing medications like biologics and such, but it applies to many people living with chronic illnesses and
It does.
conditions.
It applies to anybody who has a chronic illness who needs medication, and this is something I'm very passionate about. You guys can reach out to me and ask. I'm happy to speak about it because this personally happened to me, which is one of the reasons I have an ostomy. Is I failed on so many drugs, and instead of them being moved forward onto a next drug, unfortunately I had to wait very long times. So I'm very passionate about that. So that's just one of the things that we talked to them about this time.
Yeah. When we lobby, whether it be with the Crohn's and Colitis Foundation or the Digestive Disease National Coalition, is we lobby for funding for research. We lobby for patient affordability and accessibility to care, and we lobby for disease awareness and prevention.
In a nutshell, yes, that's true. The bottom line is you can do this too. Again, you don't have to go to Washington, D.C. to have your voice heard. You can visit your local people.
You can write letters.
You can
send emails,
email, right?
tweets.
Call, pick up the phone. They're here to listen to you. So that is our advocacy journey. Feel free to reach out to us on Patient Coaches or on Double Baggin It, and we're happy to answer any of your questions. We're here to help you. And until then,
Rock out with your bags out.